Good afternoon, everyone. My name is Daphne Steriatis, and I'm an associate with CAQH Core. It is my pleasure to welcome you all to the 2020 CAQH Index webinar. Our two presenters today are April Todd, Senior Vice President of CAQH Core and CAQH Exploration, and Dr. Christine Bernaska, Director of Research and Measurement for CAQH Exploration. Next slide, please. Before I hand the call over, I would like to mention a few logistical items. A copy of the slides and the webinar recording will be emailed to you over the next couple business days. While attendee audio will be muted during the webinar, you can communicate with our staff via the chat function on your dashboard. I also want to encourage you to submit your questions at any time during the webinar by typing them into the questions panel on your dashboard. With that, I will hand the call over to April Todd. April?
Thank you, Daphne. And good afternoon, everyone. Thank you for joining our 8th annual CAQH Index Report webinar. What we'll be covering today in our agenda is an overview of the 2020 results for the CAQH Index, discuss some high-level findings. Christine will go over some of the detailed findings by each transaction and what we're seeing there and some opportunities for the future. And lastly, I'll talk at a high level around some calls to action that we see for areas where the industry can improve and reduce administrative cost and burden. But before we get into some of those findings, we can go to the next slide. We can cover some background information around what the CAQH Index is. So as many of you probably know, given this is our 8th report, the CAQH Index is a national benchmarking survey. We collect information from health plans and providers to measure adoption of electronic administrative transactions, as well as the mode not conducted electronically through partially electronic web portal transactions and manual processes as well. In addition to adoption, we also estimate the cost and time associated with those transactions and the savings opportunities that exist from moving to more fully electronic transactions. We also share information in detail around costs, including the costs that the industry has already avoided, what the industry continues to spend, and what those savings can be achieved further for the industry. As we do this report every year, we work in a collaborative way with our CAQH Index Advisory Council. This council includes a number of experts in administrative transactions, data analysis, and healthcare management from across the healthcare industry and represents providers, health plans, vendors, government entities, and a number of other industry partners. And this year in particular, I want to really thank our Index Advisory Council for helping to craft the questions, modify them, and encourage industry adoption. We have had the highest industry participation this year, both for providers and for plans. So thank you. If we can go to the next slide. So the index itself really tracks the administrative workflow from the beginning to the end. And so we start transactions that are associated with a patient encounter and when that is scheduled. And so that starts with eligibility and benefit verifications. And so we track the rest of the transactions all the way through the workflow, including when a patient encounter occurs, when a provider submits a claim, when that claim is adjudicated, and when it is paid from the plan to the provider. We can go to the next slide. Of importance to remember as we review the results from the 2020 index are a few definitional items. So first, want to reiterate that when we are tracking costs for transactions, that these are costs associated with labor time to conduct the transactions. We purposely eliminate the costs associated with systems, including any pre-work or follow-up work and any system upgrades. You'll also see 3 specific modes that are referred to in the results of how transactions are conducted. So there is the electronic transaction, and this is typically the transaction that is that references the adopted HIPAA standard. But for some transactions, there is not a HIPAA standard, and given we track all transactions along the administrative workflow, not all of them are HIPAA standards as of yet. You will also see manual transactions. These are processes where a transaction requires end-to-end human interaction, such as with telephone, fax, and or mail. You'll also see partially electronic transactions reported. And these are transactions that are primarily conducted through web portals, but also through interactive voice response systems. Go to the next slide, please. Some additional definitions here, primarily related to our financial metrics to understand the differences that exist. One of the things that we highlight every year are the potential savings that the industry can achieve by converting more manual and partially electronic transactions to fully electronic transactions, and these are referred to as potential savings. We also have a metric that is called estimated spend. Estimated spend includes two components. One is what is spent electronically, which is the next definition, third way down, plus potential savings. So this includes what is actually spent within the industry that consists of what's done electronically and the component that can be saved. And then lastly, on our financial metrics, we have a metric called cost avoided. Cost avoided represents the amount that the industry has saved annually by previously converting partially electronic and manual transactions to fully electronic transactions. Go to the next slide, please. In terms of the transactions reported, all of the transactions that we reported on last year are also reported this year. We have added 2 additional transactions this year through additional reporting from our participating organizations that have facilitated that. And that includes reporting on acknowledgements for the first time this year, and also being able to report on attachments for the first time this year for the dental industry. Go to the next slide, please. I want to highlight a few details around the data collection effort. As I mentioned previously, this was the highest participation year of the CAQH Index in terms of both medical and dental plan participation, as well as provider participation. We saw a very large increase in providers participating this year, an increase of 37%. The data collection effort occurs from the end of June to the middle of September every year. And I will highlight for those on the call that the results reported this year are for calendar year 2019. The reason that they are reported for calendar year 2019 and the reason that we conduct this survey from June through September is to make sure that we are collecting the full scope of claim information that typically needs a 6-month run out. So specifically want to highlight that the data this year does not include the impact from COVID-19 in 2020. We will be reporting those results next year. However, we have started to collect some initial information around COVID-19 and the early months of that, and have seen a significant decline in transaction volume. As I think we all know, visits have gone down during the early part of that year. We anticipate reporting out more of these initial results in the coming months in an issue brief type format. As I mentioned previously, we are reporting similar transactions that we did last year with 2 additional ones. And we have some enhancements this year in addition to asking about COVID-19 and some of the initial results there. We have also started to ask some questions around adoption of FHIR, some questions around value-based care, and some more specific information that has helped analyze the data in this survey regarding prior authorization. We can go to the next slide, please. Next, we'll highlight some of the high-level findings that we found from the index this year. Next slide, please. So first, in terms of high-level summary findings, we have found that in general, adoption of electronic transactions improved across the medical and dental industry, with a few transactions remaining stable. But on the whole, this has been a good year for electronic adoption. We also have continued to see overall volume increases for both the medical and dental industries, and this has been led by some strong gains in electronic transaction volume. Industries related to this, we have seen a reduction in industry spending on administrative transactions as more transactions have become electronic, and specifically we have noticed this past year that the cost of those electronic transactions have also declined and become more efficient. So one of the bullet points that we have highlighted this year as well is that the savings opportunity increased for the medical industry in particular. And there's a very interesting reason for this increasing this past year. As I just mentioned, electronic costs for transactions have generally decreased, but we did see a significant increase in manual and partially electronic costs in the past year. So the gap in the cost between electronic and manual and partially electronic transactions has increased, and that has resulted in increased savings opportunities for the industry. We saw savings opportunities decrease for the dental industry, generally as electronic adoption has increased. And we have also seen annual cost avoided by the healthcare industry through automation as we have had more transactions become electronic. So with that, I'll hand this over to Christine to walk through some of the detailed findings for each of the transactions. So Christine, over to you.
Great. Thanks, April, and thanks to everyone attending. I'm now going to talk about highlights from the 2020 index. The next few slides present high-level findings related to adoption levels, transaction volume, time and savings opportunities, costs avoided, and spend. I will then go into detailed findings related to the specific transactions. We'll start by looking at medical plan adoption on slide 13. On this slide, you'll see that overall adoption increased or remained stable for all medical transactions. Adoption increased the most for prior authorization at 8 percentage points, followed by remittance advice at 9 percentage points. Among the medical transactions, prior authorization still has the lowest adoption. Next slide. Switching to the dental industry, we again see that adoption increased or remained stable for all the transactions. Adoption increased the most for eligibility and benefit verification at 13 percentage points, followed by claim status, which increased by 6 percentage points. Adoption is lowest for claim payment. Next slide. This slide shows the overall transaction volume and shows that it continues to increase for both the medical and the dental industries. This year, the potential savings opportunity increased for the medical industry and decreased for the dental industry. This is the first time since collecting dental data that we have seen a decrease in the savings opportunity, and this is associated with increased electronic adoption. Next slide. On this slide, we see that the overall savings opportunity increased by $3 billion, which was driven by the medical industry. The increase in medical savings opportunity is due to electronic costs decreasing and portal and manual costs increasing. The gap is widening between electronic and manual transactions, resulting in greater cost savings opportunities. Because as healthcare business needs become more complex, it is becoming more labor intensive and expensive to accommodate the business needs manually. This also suggests that updates to standards and operating rules may be needed for electronic transactions to address the increasingly complex business needs that are currently being addressed outside of the standard transactions. Conversely, we saw that dental savings opportunity dropped. This is due to greater adoption of electronic transactions, resulting in lower volume of costly manual and partially electronic transactions. Next slide. We are now going to look more closely at what is driving the savings opportunity. We'll start with the medical industry. There's a lot of data in this table, so I'm going to focus on some key findings. Looking at the average cost to conduct a transaction, we see that the biggest savings opportunity is for claim status inquiry filed by prior authorization and eligibility and benefit verification. On average, the medical industry could save $11.71 per claim status inquiry by conducting an electronic inquiry as opposed to a manual inquiry. Similarly, the industry could save $8.64 per eligibility and benefit verification by conducting a verification electronically as opposed to manually. Looking across the transactions reported, we found that on average, each manual transaction costs the industry $5.42 more than each electronic transaction. These savings add up, and for a single patient encounter, the medical industry could save over $43 if all the reported transactions were conducted electronically. The savings opportunity is larger for providers at almost $30, while plans could save about $13 per patient encounter. Given that portals are still widely used to conduct transactions, I wanted to point out that there are also savings opportunities associated with moving from portal use to fully electronic transactions. On average, the industry could save $3.43 by conducting a prior authorization using the HIPAA standard as opposed to a portal. Similarly, the industry could save slightly over $2 by conducting a fully electronic claim status inquiry as opposed to one using a portal. Next slide. We're now going to look more closely at what is driving the savings opportunity for the dental industry. This table mimics the table we saw for the medical industry with just fewer transactions. Looking at the average cost to conduct a transaction, we see that the biggest savings opportunity is for claim status inquiry, followed by eligibility and benefit verification. On average, the dental industry could save $10.92 per claim status inquiry by conducting electronic inquiry as opposed to a manual inquiry. Similarly, the industry could save $8.75 per eligibility and benefit verification by conducting a verification electronically as opposed to manually. Looking across the transactions reported, we found that on average, each manual transaction costs the dental industry $5.47 more than each electronic transaction. Again, these savings add up, and for a single patient encounter, the dental industry could save over $27 if all the reported transactions were conducted electronically. Similar to the medical industry, the savings opportunity is larger for dental providers at $20, while dental plans could save about $7 per patient encounter. Looking at the savings associated with moving from portal use to fully electronic transactions, we see that on average, the industry could save $2.51 per transaction by conducting a claim status inquiry using the HIPAA standard as opposed to a portal. Similarly, the industry could save $2.38 by conducting a fully electronic eligibility and benefit verification as opposed to one using a portal. Next slide. So we've seen that overall transaction volume increased and that the overall industry savings opportunity increased. We're now going to look at the overall industry spend and costs avoided as it relates to the transactions studied. Again, there's a lot of interesting information on this slide. I'm going to focus on data related to the overall medical and dental industry combined, as we will discuss the medical and dental industries separately in upcoming slides. Before I talk about the estimated spend and costs avoided, I want to remind people that the estimated spend is represented by combining the purple and teal bars, and the cost avoided is represented by only the gray hatched bars. Looking at the bottom two bars on the chart, we see that spending for the medical and dental industry dropped from 41 billion to 39 billion. In general, the industry is spending less conducting the transactions, and this is primarily due to greater electronic adoption and lower electronic costs. The industry also avoided more costs this year by automating more transactions that would have cost more if they were conducted manually or partially, given that manual and partial costs have gone up. We have seen a $20 billion increase in costs avoided, rising to $122 billion this year. Next slide. As I mentioned, we're now going to dig deeper into the medical industry to see what is driving spend and costs avoided. Based on reported data, the medical industry spent an estimated $33 billion conducted listed transactions. This amount is down from $34 billion last year. Of the $33 billion, eligibility and benefit verification accounts for almost half the spend at 47%, followed by claim submission and remittance advice, which both account for 17% of the total annual spend. It is worth noting that the largest decrease in spend from last year is for claim status inquiry, while the largest increase in spend from last year is for claim submission. Focusing on costs avoided, we see that the medical industry has avoided $117 billion through automation, up from $96 billion last year. By automating eligibility and benefit verification, the medical industry has avoided spending almost $86 billion, which represents 73% of the total cost avoided. Next slide. Looking at the dental industry, dental spending also dropped from 6.6 billion to 5.7 billion. Of the almost 6 billion spent on conducting the listing transactions, eligibility and benefit verification and remittance advice each account for 24% of the total annual spend, followed by claim status inquiry, which accounts for 19% of the total annual spend. The largest drop in spend from last year was for eligibility and benefit verification. Before moving on to costs avoided, it is interesting to note that both industries spend the most on eligibility and benefit verification, followed by remittance advice. Focusing on costs avoided, we see that the dental industry avoided $5 billion through automation. By conducting eligibility and benefit verification electronically, the industry has avoided $2.7 billion in costs, which accounts for 52% of the total cost avoided. Next slide. In addition to estimating cost savings opportunities, we are also able to estimate time savings opportunities by moving from manual to fully electronic transactions. Looking at the medical industry, we found that on average, providers spend 9 more minutes conducting manual transactions than electronic transactions. For patients requiring all 7 medical transactions, a provider could save on average an hour by conducting all transactions electronically instead of manually. Focusing on the individual transactions, we saw that the highest time savings opportunity is for claim status inquiry. On average, a manual claim status inquiry required 19 minutes to complete, while an electronic inquiry required 2 minutes to complete. Providers could save 17 minutes by conducting an inquiry using the HIPAA standard as opposed to calling, emailing, or faxing. Just as there are cost savings opportunity associated with switching from portals to fully electronic transactions, there are also time savings opportunities. On average, a medical provider could save 15 minutes by conducting the reported transactions using the HIPAA standard as opposed to via a portal. Next slide. Moving on to the dental industry, we found that on average, dental providers spend 7 minutes more conducting manual transactions than fully electronic transactions. For patients requiring all 5 dental transactions, a provider could save on average 37 minutes by conducting the transactions electronically instead of manually. Focusing on the individual transactions, similar to the medical industry, we saw that the highest time savings opportunity is for claims status inquiry. On average, a manual claims status inquiry required 17 minutes to complete, while an electronic inquiry required 3 minutes to complete. Dental providers could save 14 minutes by conducting an inquiry using the HIPAA standard as opposed to calling, emailing, or faxing. By switching from portal use to fully electronic use, a dental provider could save on average 11 minutes. Next slide. Okay, we are now going to dig deeper into the individual transactions along the administrative workflow. For each transaction, I will share trends in adoption and volume, and where possible, I will provide context around the findings. We will start with the eligibility and benefit verification transaction. Next slide. On slide 26, we will start by looking at adoption. When we look at adoption, we see that the medical adoption remains stable at 84%, while dental adoption increased 13 percentage points. Among the dental transaction, this transaction experienced the highest increase in adoption. It is worth noting that this increase may be due in part to the ADA's effort to promote administrative simplification for the verification process through standardization of data elements. Next slide. This slide presents the trends in transaction volume for the 3 modes studied. Overall, this transaction continues to have the highest reported volume among the transactions. We see that medical volume increased for all modes. Conversely, overall dental volume decreased 8%, driven by a decrease in manual and partially electronic volume. Electronic volume increased 11% from last year. Before moving to the next transaction, I want to mention that the number of transactions per member increased for the medical industry from 30 to 33 and remains the highest per member among the transactions. The dental industry remains stable at 2 transactions per member. Next slide. Moving on to prior authorization, we have good news to report. Adoption increased 8 percentage points for the medical industry, which is the highest increase in adoption among the medical transactions. We were curious to understand this increase, so we asked respondents and council members if they could provide some context. Medical plans indicated that adoption may be up due to efforts to move processes away from outdated legacy systems into the X12278, which has garnered more interest from the provider community. Medical plans also reported a reduction in web portal volume and commented that this reduction may be the result of iterative portal enhancements and defects which have impacted provider usability, as well as an increased interest from providers in the electronic prior authorization transaction. These comments, along with the industry effort to reduce burden associated with prior authorization, provide some context around these findings. Next slide. Looking at the number of prior authorizations conducted, we see a large increase in the number of electronic prior authorizations conducted and a decrease in the number of prior authorizations conducted via a portal. As stated previously, provider interest in conducting a fully electronic prior authorization may stem from issues using portals. Next slide. Focusing on claim submission adoption, we see that medical adoption has remained stable for the last 3 years and that dental adoption continues to slowly increase. For both industries, this transaction continues to have the highest trended adoption rate among those reported. Next slide. Although adoption has remained stable, overall transaction volume has consistently increased for both industries. It is interesting to note that for the medical industry, claim submission has the second highest per member volume at 12, following eligibility and benefit verification at 33, while the dental industry per member volume is 2. Next slide. Before I talk about adoption of attachments, I want to note that an electronic transaction standard has yet to be federally mandated by HHS, which has impacted the adoption of this transaction. Plans, providers, and vendors have been hesitant to develop standardized approaches to automate the exchange of attachments because of the lack of a mandate. This has led to incomplete solutions and manual workarounds, as evident by the data on this slide. Given this, for the medical industry, we see that electronic adoption increased slightly by only 2 percentage points. For the first time this year, we were able to report on attachments for the dental industry and see that their adoption rate is similar to that of the medical industry. Next slide. On this slide, we see a sharp drop in manual volume for the medical industry. Interested in understanding the decrease in volume, we asked respondents about this. Medical plans indicated that the volume of attachments may continue to drop as plans reduce the number of attachments required for certain bill types. Next slide. For the first time this year, we are able to report on acknowledgements for the medical industry. The index measures the number of 999 and 277 CA transactions. The 999 acknowledges all X12 transactions submitted in batch mode, while the 277 CA acknowledges receipt of a claim by a plan or vendor. As you can see, this transaction is highly automated, given many systems automate this response. Next slide. Moving on to coordination of benefits, we see that electronic adoption continues to increase as manual use decreases. Next slide. Looking at volume, we see that compared to last year, the medical industry is conducting more coordination of benefits overall. The increase in volume is driven by a large increase in the number of coordination of benefits conducted electronically. Next slide. On this slide, we see that medical adoption of electronic claim status inquiry is up slightly after dropping a percentage point last year. And while dental adoption increased 6 percentage points, manual use also increased 7 percentage points. These increases were accompanied by a significant decrease in portal use. Next slide. Looking at the number of claim status inquiries conducted, we see that for the medical industry, electronic and partially electronic volume increased about 20%, while manual volume decreased. Overall, dental volume drops driven by a significant decrease in portal volume. Next slide. Now we will look at claim payment. For the medical industry, we see that adoption of electronic payments continues to steadily increase, while the use of manual payments such as checks continues to decrease. Focusing on the dental industry, we see that adoption of electronic payments has been slower and remains stable at 13%. The low adoption rate is due in part to dental providers being hesitant to trust the exchange of electronic funds due to security and other concerns. Among the dental transactions, payment has the lowest adoption rate. Next slide. Looking at the volume of payments exchanged, we see that volume increased for both the medical and dental industries. Electronic volume is up 12% across both industries, which matches the increase in electronic volume cited by NACHA during this timeframe. Similar to last year, for the medical industry, the overall increase in volume mimics that for claims submission, with payment volume being lower due to bulk payments. Next slide. And lastly, we will talk about remittance advice, the final transaction in the administrative workflow. On this slide, we see that adoption continues to increase for both the medical and dental industry. Portal use has dropped for the medical industry and manual use has dropped for the dental industry. Next slide. Unlike last year, we see that overall medical volume is down. This decrease is driven by a drop in the number of remittance advices conducted using a portal. This drop is interesting given that the use of portals steadily increased over the last few years due to duplicate postings. Health plans indicated that they posted remittance advice information on portals and through ERAs to allow providers multiple means to access the information. Based on this year's data, it looks like this practice may be declining. As we continue to track this data, it will be interesting to see if this trend holds over time. While medical volume decreased, we see that dental volume increased due to an increase in the number of remittance advice conducted electronically using the X12 835. It's worth noting that we have seen a steady increase in electronic volume and decrease in manual volume over the past few years, which is an encouraging sign for the dental industry. Well, that concludes my discussion of the detailed findings related to the transactions studied. For more information on the individual transactions, I encourage you to look at the 2020 Index report, which is posted on the CAQH website. I'm now going to turn the presentation back to April to talk about actions that the industry can consider to help maintain and improve on the achievements just discussed. April?
Thank you, Christine. So as we look at the results from this year and the couple previous years from the index report, there are three particular actions that are recommended for the industry to consider. The first is to focus efforts to address the biggest cost savings opportunities. As you'll see in this report, the medical savings opportunity significantly increased this year due to increased manual and web portal costs. So there's definitely opportunity to reduce those costs for the industry to move more of those transactions to an electronic format. The largest opportunity that we have seen is around eligibility and benefit verification. It has the largest cost savings opportunity overall due to a couple of things. First, just that the electronic cost has declined for eligibility and benefit transactions, but has increased significantly for manual and web portal transactions. And just due to the pure nature of the fact that the eligibility and benefit transaction by volume is the largest volume transaction conducted within the medical industry. There are a number of opportunities to reduce cost in this area that I'll cover in the next few bullets. The third area is around prior authorization. Prior authorization is one of the transactions that the industry has been working on for a long time now, particularly over the past couple of years. What we have noticed in this year's survey is that it has the highest web portal transaction cost. We also hear from providers that they are struggling with web portal transactions. And so there is some opportunity here to work with providers to help reduce that administrative burden. Secondly, call to action is to accelerate standards and operating rules to address emerging market needs. So this is a follow-on to the point I had made above around eligibility and benefit, where we see with that transaction as well as others, there are increased manual and web portal costs. And some of this is likely due to the fact that we have emerging business needs that may not be well addressed by the existing standards. And so those complex business needs are moving outside of the transaction and being conducted through proprietary web portals and through manual methods. And so we really need our standards and operating rules to accelerate to address these more complex and emerging business needs. For example, in areas like value-based care, where we need to put in that effort to ensure that we can incorporate that into the administrative workflow. Now, there are a number of government and industry efforts that have been underway to focus on improving this process. In particular, there have been a number of efforts over the past year through HITECH, ICAD, NCBHS, Da Vinci, X12, and others to really focus on how we can connect and support the needs of connecting administrative and clinical data together. So it's one strong effort in the industry that definitely should continue. And then third, a call to action is to really capitalize and expand on the progress made to date. As Christine has mentioned, there's a lot of positive progress in this past report made by the dental industry. For almost every transaction, there has been an increase in adoption. And so definitely want to make sure that we can expand on that progress by the dental industry. And also as an example for the medical industry, we've also seen some significant improvement in prior authorization over the past year. The industry has put a lot of effort in this space, and there's encouragement that some of that is working, but there's definitely more work to be done to improve within this space and to build on the progress that has been made. And so with that, Daphne, I'll hand it back over to you. We would be happy to take some questions from the audience.
Thanks, April. And before we jump into our Q&A section, a couple quick reminders here to please submit your questions by typing them into the questions panel on your dashboard. Additionally, both the slides and presentation recording will both be available on our website and be emailed out to all webinar registrants within the next couple of days. So back to you, April.
Okay. So we have a couple of questions coming in here. The first one, Christine, is around how this data should be interpreted to impact patient care. So if you could maybe just address briefly really how what we're doing with the index can help support care for patients.
Sure. So as you're thinking about the cost of care and what patient encounter entails, the doctor, as we just talked about, conducts many transactions along the administrative workflow during a patient encounter and therefore after the patient encounter. So what the index shows is that there's various ways in which providers and the healthcare industry in general can reduce these costs that will not only make healthcare more affordable for patients, but also will allow the doctor to spend or the physician to spend more time with the patient, which hopefully then will improve the overall patient experience. April, I don't know if you have anything else you'd like to add.
No, I think that the affordability and time-saving component definitely should have a large impact on patients. Another question coming in, Christine, is around claim payments. And so this questioner noted that there continues to be, even though there has been improvements, there continues to be a big gap, large gap between the medical and dental industry and providers accepting electronic payments. Based on your conversation with council members and others, can you maybe elaborate on a bit more as to why the dental industry is continues to lag in this space?
Yeah, sure. That's a great question. And as you mentioned, April, we've talked to council members as well as dental plans and providers. So anecdotally, what we're hearing is that dental providers tend to be more fearful of electronic transactions or the exchange of funds. And this is due to for security reasons and also just fear of the exchange of the funds over the internet or through the web. Many dental providers have actually told us that they feel more comfortable with a check in hand, and so that's comforting to them. They know they have the payment in hand, and they have no issue going to the bank to deposit a check. In some cases, many have put that into their routine, and on Fridays as they're going to lunch or doing something or running errands, they then will go to the bank. So I think that those two reasons are probably what's driving the slow adoption of dental payments. And as the dental industry works to inform providers that there are a lot of benefits to using electronic payments, such as efficiency in payments, and also that they can be trusted, that we hopefully see the adoption rates increase.
Great, thanks, Christine. So there's another question coming in here on telemedicine, which I think is a great question given the growth that we've seen in telemedicine the past year. The question is telemedicine tracked by the index? In particular, can we see how plans and providers are changing checking eligibility or filing claims. So I'll be happy to take this one. As I mentioned, this is a great question. Telemedicine in particular is not tracked independently in the index, but it is related to all of the transactions that the index tracks. Within the past year, we would not have been able to see any specific differences on that because the index is tracking data from 2019, but we are looking at how to ask some questions, potentially modify, add new questions next year to get at some of the uniqueness that occurred in 2020 with COVID. And so we would want to look at things like, what is maybe the impact on eligibility, on, filing claims, maybe checking the status of claims, and also payment on that. So that's definitely something we are going to want to look at into the next year and see how much telemedicine may be impacting this. The other thing that I would mention here as well is just some work that we are planning to do in CORE in the next year around telemedicine, and in particular, looking at some updates related to the eligibility transaction to help support telemedicine within that transaction. And so we'll be looking for organizations to participate with us this year on that particular issue. Okay. All right, so let's see here. Another question, maybe Christine, related to the one I just answered, if you want to take this one. Do you have any initial indications of how COVID has impacted data exchange in 2020?
Yeah, that's a great question. I think, April, as you reminded folks in the beginning, this year's report, or the one we just presented on, is for calendar year 2019. So it does not include any data related to the impact of COVID. We did though ask some initial questions on how transaction volume has been impacted by COVID. And we hope to look at those results in the upcoming months and be able to present an issue brief or an infographic on how COVID had impacted transaction volumes. And I think, April, as you had mentioned, we have seen that transaction volume, or actually we have heard that transaction volume has decreased due to COVID. In the upcoming data collection effort, which will begin in the spring and summer, we will start seeing the impact of COVID. And so hopefully next year we'll be able to report on adoption, cost, spend, as well as time, and how that has been impacted by COVID.
Great, thank you. So I have a question coming in here around attachments, and asking us to just confirm or define the types of documents that are considered as part of the definition of attachments. This is another good question because as Christine had alluded to earlier in the presentation, there is not, this is one of the transactions that we track that does not have a, or defined by HHS yet, or required by HHS. So when we track this transaction, what we call electronic are transactions that go through the X12275, as well as transactions that would go through an HL7 standard, so like the CCDA or FHIR. We are not really seeing use of FHIR yet, but we are seeing folks that are using the CCDA. In terms of the transactions that we are asking for the 275 and for the CCDA generally, are around prior authorization attachments or clinical documentation that would go with that, as well as clinical documentation needed or requested for claim payment, for claims submission. So those are the things that are included in that definition. Okay. Let's see here. So another question, Christine, that I will throw your way here. It's another definitional question. What is all included in medical? Does that include pharmacy, for example, within metrics, or is that separate?
Yeah, that is a great question. The medical, what's included in the medical transactions? It does not include pharmacy. It does not include behavioral health. It does not include vision. I will say, though, specifically in regards to pharmacy, that this year we have started collecting data on some pharmacy transactions. And in, I think it was early December, we actually put out an issue brief on some initial findings related to our pharmacy service index. And we were able to report on 3 transactions for the pharmacy service index: eligibility and benefit verification, prior authorization, and claim submission. And we are currently working with the pharmacy industry to not only expand on the pharmacy service index, as well as learn more about it and learn about the transactions and what questions we can ask of providers, plans, and pharmacies. The pharmacy service index that we did, the findings that we did put out, were only from PBMs. And so our goal is to start incorporating pharmacy service questions into the index as we move forward.
Right. We have another question coming in here to understand maybe some of the differences that exist between the metrics that we report on adoption and volume, and where some of them may not exactly line up, which we can definitely answer that question or highlight a point from earlier around that. So when we are looking at the adoption percentages, those reflect the adoption percentages for the plan side of the transaction. When we are looking at volume, the volume incorporates the volume both reported by providers and for plans within that methodology. We have a more detailed methodology within the index report towards the back if those are interested in understanding the differences between those two metrics and why they are calculated that way. So thank you for the very in-depth question, and hopefully we've answered it at a high level there. And if you'd like more information, please look at the methodology section in the back of the report. Let's see here. Let's see. We can do one more question here. I'm just noticing the time that we have. Christine, there's a question here around just the 39 billion that's reported in the report. Seems like a small section of the larger administrative spend within the industry that we mentioned in the report, the 372. Can you help to just identify some other administrative components of that larger number that are not included in what we look at when we're measuring the transactions?
Yeah, sure. So in addition to the transactions, administrative complexity also includes things such as credentialing, quality metrics, system costs, such as EHRs, systems, and administrative and clinical systems, as well as regulatory and compliance activities.
Great. Thank you, Christine. And it looks like we're actually coming up on our hour, so I'm going to turn it back over to Daphne to close us out for the afternoon. Thank you, everyone, for listening in.
Thanks, April.
Big thank you to our speakers and the entire Index team. And of course, thank you all for your interest and for joining us today. You can find the 2020 CAQH Index report on our website at www.caqhindex.org, and you can contact the Exploration team at explorations@caqh.org. Have a great rest of your day.